What do conditions like degenerative discs, disc herniations, and pinch nerves all have in common? They are all chronic conditions that can be effectively treated with a chiropractic technique called flexion distraction. Now, a lot of patients, when they get diagnosed with any of these conditions, might run to their medical doctor for treatment or even seek a surgical consult. But this might not be your best option, even if your pain or your condition is severe. But don't take my word on it. What does the research say? But first, what is flexion distraction? It is a specific chiropractic technique that was invented decades ago, and it uses this fancy smanchy table here, where the patient is put in passive flexion. There's little to no pain involved. It reduces pressure within the disc and the nerves, decreases pain, widens the spinal canal, and then also restores motion in the spinal joints. So just how effective is it compared to other treatments? Well, we can take this study right here, which is a randomized clinical trial where they compared flexion distraction with physical therapy exercises. One group received the chiropractic procedure, flexion distraction. Helpful to note that the procedure actually lasts 3 to 5 minutes. Another group received physical therapy for 30 to 45 minutes, in which they received various exercises, including flexion extension exercises to increase the stability around the spine. The subjects that were in the flexion distraction group received greater relief than those that received the PT. In fact, those that were labeled more severe and chronic actually improved the most with the flexion distraction protocol. And the patients that had radiculopathy, which means sharp shooting pain or sciatica, actually improved even better. So I want to show you another research study that was done on the exact same technique. And this was with people who had lumbar degenerative disc disease. In this study, there were two groups, one that received flexion distraction for 3 to 5 minutes, and then the other one, which was a control, and they received no intervention at all. Those that are unfamiliar with degeneration, this is something that most people will experience as they age. So here I have a normal spine here, and this is what a degenerative disc looks like. So you can see that the bones are closer together. With this particular study, they used special imaging to measure before and after the treatment, and they found that there was significantly decrease in pain, and there was actually a significant improvement in the disc height, as well as spinal mobility and function. And this is why I will do flexion distraction on most of my patients, specifically if they're over the age of 40, because most of us are experiencing some kind of degeneration, whether or not we have pain or not. In my next video, part 2, I'm going to talk about surgery. And yes, I'm going to bring you the receipts. So like and follow for more.